We're ready. Yeah, we're ready. 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 Ready.
Welcome back to the Now Morning Show. It's 24 minutes past the hour of 7 o'clock, and this morning we have in studio with us, I have to say now, no stranger to the Now Morning Show, Dr. Rohit Das, who is the founder of Freeport Medical. Good morning and welcome.
Thank you very much. Good morning again, and good morning to all the viewers. I'm extremely happy to be here to be talking about a very important topic of cancer.
Yeah, it is very important. But before we get into the topic of cancer, can you just remind us a little bit about Freeport Medical Centre, because it's such a powerful centre and such a powerful story.
Yes, definitely. Well, I'm the Medical Director of Freeport Medical Centre, and Freeport Medical Centre is located 3 buildings from the Freeport Police Station. We've been in existence for the past 20 years, and we cater a lot for preventative care medicine and treatment of chronic illnesses. We have a very strong program for cancer screening for both men and women, and we have a family physician department which treats all patients of different ages, including the elderly, middle-aged, even children, where we provide vaccines and circumcisions and so on. We, at Freeport Medical Centre, we also have the free clinic, which exists on 2 days for the week, Wednesdays and Fridays in the afternoons, and you don't need an appointment to attend the clinic. And we also have outreach programs which we plan ever so often throughout the year.
Very community-based, and later on in the conversation we're going to get to talk a little bit about what's happening in the community in August. But let's now go to the crux of our conversation. Cancer, unfortunately, it's something that many of us know about, many of us have experienced as well. But what exactly is it?
Yeah. Wow, cancer is a really an enormous topic. Mm-hmm. It's a topic that has a stigma and a phobia attached to it, and really and truly, I would really like to bring out some important points today, and I would like to ask the viewers to stay on. There's a lot to learn about today's discussion. It's, first of all, the World Health Organization considers cancer to be the second major cause of death, and they rank lung cancer and colorectal as the top 2 causes of cancer. In terms of cancer itself, the pathophysiology or the physics involved in cancer is that a cell in the body, it could be from any organ, has gone through some changes known as mutation. And this mutation goes through different phases, resulting in a cell that is now multiplying at a remarkable rate and causing growth and taking over that particular organ. Now, it can come from any cell. It could be from the lung, from the breast, from the cervix, from the colon. But when this happens, it starts spreading. And this spread is known as metastasis. And it can spread into neighboring organs, as well as this cancer cell now could enter the lymphatic or the bloodstream and spread to distal organs like the liver and so on. Now, if a patient has cancer, they need to have a proper diagnosis by a biopsy and then a CT scan in order to detect the spread of cancer, where you decide the stage of it, and then the doctor now would sit and provide a treatment plan for this cancer. Right?
It's a lot.
I wanted to explain it so that persons could have a simple understanding. It is plenty more complicated than that, right? And just to add to that, in Trinidad and Tobago, the 5 top cancers would be breast,
right,
prostate, colorectal, lungs, and uterine.
Doctor, why is this such a major health issue locally?
Right, so that's there's also a big theory behind that. From past times, there's been a stigma and a fear. Rightly so, because of the morbidity and mortality involved in cancer. People don't have a really long lifespan when you become diagnosed with cancer in many cases. And this stigma creates a fear of patients going to get tested and get screened. And because of that, patients don't go, and it creates a ripple effect or a worsening effect where you don't go for screening, so you don't know if you have it or you don't have it. And then as a result of that, it's detected at a late stage, which is like stage 3 or stage 4, where now it has a very poor prognosis, a very poor morbidity. And that stigma is where we really have to try to get patients to understand that the fear of having cancer and the stigma should be overcome by knowing that cancer can be treated if it's detected early.
Yeah.
That's the key thing. So it has to be detected early, and once it's detected early, then you can cure the cancer. But then, if a cancer is detected at a late stage, like stage 3, stage 4, there is a not very much that can be done, and it can be treated, but there is no cure for cancer at that stage.
And that's the thing. So we really need to, as you mentioned earlier, that stigma attached to it. So it starts with us as individuals and our families and friends, sort of helping to shift the mindset and shifting out of fear.
Yes.
But it is a challenge, right?
It is a big challenge.
So this is why we have conversations like this, so we can talk and hopefully start to just make those changes slowly but surely. But now, you said early detection is very important, which we realized from this conversation. What steps do people need to take? How early is early enough to start screening?
Yes. I would say that I would like to break it down very simply and divide it into 2 categories. And this is really important, what I'm going to say, in terms of having an idea when is the time and when you should take action, right? In terms of the screening and the symptoms of cancer, I would say that I will divide it into symptoms and then the tests. So there are some important symptoms that patients should be looking for. And as soon as you see these symptoms, you should see a doctor. And I'm going to list them out. These symptoms would include patients who are over the age of 40 should check and make sure if there's a symptom of weight loss. And especially if it's unexplained, if you're not dieting, you're not exercising, there are no other medical problems, and you have weight loss, you should see a doctor right away. If your appetite is dropped and you, for weeks or months, you're not realizing that, I don't feel to eat, what's happening? You need to come and see the doctor. If you're passing black stools, that's a big sign of cancer. If you're passing blood in your stools, is very important as well. If it is that you're passing urine with difficulty, so sometimes you go to pass urine and it's not coming out, particularly in men, or if you're passing blood in your urine, very important. If you have a chronic cough, you're coughing and this cough is going on for months, over 40, and you have a cough, especially if it's associated with some of the other previous symptoms. If you're coughing and you're bringing up blood, that's another symptom you have to look out for. If your patient is menopausal and she is now postmenopausal over 50, 55, and start back to have a period, that is not normal. So you need to check for cancer. Come and see the doctor. If it is after intercourse, you're having bleeding, that's a very important sign as cancer as well too. 11th, if you have a breast lump, immediately please come and see the doctor. And if you have a discharge from your nipples, especially if that discharge is blood. So those 12 symptoms, if you're over 40, take note of it. You need to come and see the doctor if you have these symptoms. They are important symptoms of cancer. Right?
Yeah, those are important symptoms.
If it is that you're over 40 in men, you need to go and do a prostate examination, and you need a prostate ultrasound and a PSA blood test.
Okay.
That's critically important for over 40. In women, if you're over 40, you need a breast exam, an ultrasound of your breast, and a mammogram for women. All women who are sexually active should be having a pap smear. Once you become sexually active, you need that. And over the age of 40, whether man or woman, should have a colonoscopy to check for colorectal cancer. This is critically important, and it can be done via a screening CT colonoscopy, which is very reasonable, and in terms of a traditional type of colonoscopy, which is very expensive. And patients can have these tests done to screen for cancer. All of these tests are available at Freeport Medical Centre.
Yes.
And they're very reasonable. We believe in doing our part to make healthcare affordable and accessible.
100%. Now, before we get to that, though, one of the things I really would like to touch on, because it's something we hear many people say, they're like, well, like, I don't smoke or I don't drink, so I'm not going to be susceptible to cancer. But you do find that those who have really, let's say, never partaken in anything like that in their life, they end up being diagnosed with cancer.
That's an amazing point you brought up, yes. Now, cancer, the theory is that it is generated from two sources. One, a genetic cause, and then environmental causes. The genetic cause is exactly what you said. So you may have a family member, a close family, like a father, brother, sister, grandparents, who have had any type of cancer. And if it is that a family member have cancer, you must check. Then you have to be even double vigilant, because you may be doing everything correctly and still it affects you. And secondly, the environmental causes, I would like to throw in here that persons should try to avoid certain things that may be predisposing you to cancer, like smoking, alcohol. Keep it at a very limited amount. Exercise, as we said last time, exercise regularly, and eating a proper diet rich in fruits and vegetables. There's another thing important as well. There's something called carcinogens. Carcinogens are the precursors, sometimes elements that could cause a cancer, like asbestos is well known to cause cancer, as well as benzene, which is found in other products as well.
So to be situationally aware and know what you're putting into your body, but also being aware of your family history. Now, one of the things you would have just seen on your screen was some of the blood, the daily cancer screening blood tests that are available at the Freeport Medical Centre, so you should definitely go and check it out. Of course, you also have some other services that would have come up, the heart health package, the proactive package,
yes.
The teachers special discount for 10%, and ladies, a mammogram for just $350.
Yes.
Also, these are just some of the services that are offered at Freeport Medical. I know when you were here last time, one of the things that was really critical to you was the community and how important it is. And you did mention that you do also have some outreach services. What are they?
Yes. Right. So we've had a program known as the She program, where for the month of June and July, we are collecting women healthcare products, and we are distributing to the less fortunate and persons who are deserving. We had some hampers given away in June, which was very successful, and we also doing one at the end of July. So we are asking persons from the community and businesses and so on to donate wholeheartedly. This is a very charitable and deserving program that we have going on, and we would like to make it very successful coming up in July. These donations can be given at our center at Freeport, at RD Good Health in Shogunas, at Premium Blocks Limited in Arima, Nativia Natural, and Bloom Coffee. Now, we also have coming up on the 17th of August a family health fair, a health fair and a family day. This is going to start in the morning with a 5K walk or run. Our motto is run or walk for a healthy you. And we would like to invite everyone to come and participate. It's a free event, and you don't have to pay. There will be lots of games, and there will be screenings. Doctors will be available, free visits, etc. going on the day, and we will also be having fun activities for the children as well too.
Again, so community-based, which is one of the great things and great benefits of going to the Freeport Medical Centre, and I'll say becoming part of the family as well.
Yes.
Dr. Das, unfortunately we are almost out of time, but before we wrap, do you have a final message you would like to leave with our viewers?
Cancer is a big thing, it's a big topic. There is a lot of phobia, a lot of fear, a lot of stigma attached to it. I would like to say now, let us use the concept that if you get early diagnosis, early screening, you can be treated. If you do have the illness, if you screen and you don't have it, at least you know that your status is negative. But you need to do early screening, early tests. Let's find out what is your status with cancer. It is a very common problem. All these tests are available at Freeport, including the pap smear, the mammograms, CT scanning, all the tests, blood tests that is required for for testing for cancer.
Well, Dr. Das, thank you so much for joining us this morning. It's been a pleasure and looking forward to seeing you again soon, hopefully before the health fair in 5K.
Yes, definitely. Thanks very much for having me.
Of course. Dr. Rohit Das, the founder of Freeport Medical Centre, here with us this morning on the Now Morning Show, sharing with us the intricacies and behind the scenes with cancer. Stay tuned. There's more coming up after this break.
Yeah, we're ready. 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 Look how the sun now raising up, and the crowd now waking up. The atmosphere have vibes, and nothing can break it up.